HHV-6 reactivation after transplant is very common. However, very few studies have evaluated the real incidence of HHV-6 reactivation after haploidentical transplant with post-transplant cyclophosphamide. And in particular, we conducted a study with 100 patients who received haplotransplant with PTCy, and in the GvHD prophylaxis, most of them received low-dose ATG. So what we find is that the incidence of HHV-6 reactivation is 54%, which is not higher than what we would expect in transplants with non-haplo donors, such as match-related or unrelated donor. It's in line with what we find in literature for patients with non-haplo transplants. One particular finding of this study is that the main risk factor for HHV-6 reactivation was having a low lymphocyte count at day plus 30. So overall, I think that this study showed that it is safe to combine ATG and PTCy in terms of risk of HHV-6 reactivation. When HHV-6 reactivates, there is a higher incidence of acute GvHD, delayed platelet engraftment, as it has been shown in other type of transplant settings. And maybe in patients with a lower absolute lymphocyte count at day plus 30, it should be more cautious to monitor HHV-6 and its possible complications.